everyone. Glad you could join us tonight. Tonight we're going to have a fabulous webinar. I've got Anita Saltmarche on tonight and Dr. Margaret Naser. Both of them have incredible experience in using light on the brain. And so, you know, we've been able to see it ourselves for the different things with Parkinson's, with concussions, with strokes, all kinds of things. And I'll mention as well for those that tune in at the end, well, I guess we will be giving you the results of the draw from last month. Every time you tune in, you get a ballot. If you watch the webinar to pretty much to the end, you get a ballot. So if you watch 4 times during the event of the month, then you get 4 ballots in. And then we do a randomized draw, and somebody will win the Palm Ultimate. That's this device here. And it has the 660 nanometer, the very bright red, which you can see going right through my hand there. And it has the near infrared wavelength of 810 nanometer. This one here, which you can barely see. But if we were to measure what comes through that hand, there's far, far more coming through there as well. And anywhere from 10 to 30 times more with light that you don't see. And that's because the energy can go that much deeper when you're using the 810 nanometer. Now, just because we're going to be talking about the brain tonight, a lot to do with different applications for light on the brain. I want to, when we're talking concussions and some of the other issues and even Parkinson's, what about, this is a real human skull, this one here. We call him Alfred. We're very, very thankful for how I was able to get this helmet, this skull. But it is a real human skull. You can see here the intricate suture lines. But why I like this so much is people say, can the light go through the skull? Yep, it can go right through the skull. And as a matter of fact, the red, as you see it, is going right through the skull like you're seeing it. And then the near infrared, which you can't see, is far more is coming through. I just can't show it right now with my setup, but I have done that where I put a meter inside and measure how much is going through the skull. And it's amazing to see that you could be looking at 10, 20 times more energy coming through this skull in the longer wavelengths of 810 or 1050. So we have, because we're getting into a lot to do tonight about the brain, it is very, very possible to treat the brain with light, as I'm showing there even with the Palm Ultimate. It's possible to do like 1 minute of red and 3 minutes of the near infrared with this device and effectively treat the whole brain. Now that takes a lot longer to do than a device that has 10 of them on there. This is our helmet, which has basically 10 of these devices distributed across the entire helmet. So when we're looking at treatment, we have a stand that holds it in place for clinics and that, and this just pulls down. Now, because of our camera angle, it's going to be a little tough to see it perfectly. But here you go. There's the red wavelength, and here's the near infrared wavelength, which I said doesn't look very impressive, but is actually penetrating far deeper into the brain. And you will hear very shortly here the beautiful, beautiful things that Anita and Dr. Margaret Naser has been able to research in what PBM can do. So right now we're just going to go into our short video, and then we're going to come right into our event.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
All right. So now we're going to have Anita Saltmarche come on, and she's going to be presenting about photobiomodulation and the use of photobiomodulation with transcranial. And Anita, you're almost looking great, but maybe you could just do your hand wave in front of it, and it causes it to refocus. Go right up to your camera, and
Okay, is that better? Did it
it
focus?
should. I think you got to hold your hand right in front of it. There we go. We got it. I think it's good.
Got
There,
it?
perfect. All right. All right. That,
Technology, isn't it wonderful?
yeah, especially when it doesn't want to cooperate. That gets a little
That's
rough
right.
sometimes.
It does.
Well, Anita, it is so neat to have you on tonight. And you're familiar with this guy here, right?
Yep, I am.
That's that's our device. But so tell people about yourself.
Sure. Um, uh, when I first started out in the profession, I was a nurse and then a clinical nurse specialist geriatric at Sunnybrook, one of our large teaching hospitals in Toronto, and did that work for quite a while and then moved into photobiomodulation. And that's what I've been doing for the last 25 years.
Wow. You were
Yeah.
one of the very early adopters. How did you end up getting there? Like, what got you thinking that you want to try light on the brain?
Right. Well, the brain was sort of secondary to starting out, which was treating musculoskeletal conditions. So
Oh, really? Okay.
joints, muscle, athletes, weekend warriors, all of those individuals, and injuries. And so from there went from that to neurologic conditions.
So first, though,
And
you were using PBM, then
absolutely,
at the beginning, it
PBM.
was called low-level light therapy,
That's right. It
low-level
was
laser
called,
therapy. I mean,
yeah, many
all the
different names, low level laser therapy, light therapy. Um, and when we first started out, we thought lasers were the only way of delivering light. But we now realize that LEDs can be very effective as well, especially for transcranial treatment. And that I've been doing for about 20 years now. Started out with actually Dr. Margaret Nazer will be joining me later when we talk about some of the learnings and guiding principles for using PBM in neurologic conditions. But we did an Alzheimer's and dementia study, and from there moved on to concussion. She's done quite a bit of work in the area of stroke. And then autism and treating children, I've been involved in, as well as more recently, and that's what I'm going to present tonight, are the results, our results from the Parkinson's research study that we completed recently and published. And I'll give you a link to that publication. So yes,
excellent.
you'll be able to have that at the end. So
Okay.
yeah.
Excellent. Excellent. So when you would like Margaret to join us, we'll just ask her on
Okay,
and
perfect. That would be great.
okay. So great. So you started using the at first you started using just light on pain and inflammation on the body,
Yes, and it's
and then
very successful for that, treating pain,
oh yeah.
inflammation, injuries, accelerating. I did a wound care study in long-term care, looking at the use of light therapy for individuals, predominantly leg and so venous insufficiency ulcers, as well as ulcers caused by pressure. And
Mhm.
so we had very good results. So we know that we can accelerate wound healing as well. So very important. So tissue,
You probably saved some legs from being amputated, I'm sure.
hopefully, yes.
Okay.
And many of my colleagues certainly have.
Yeah.
They've done a lot of work in that area, and it's really wonderful.
I was able to see that myself with two individuals they were both to have further amputation.
Mm,
Well, one major amputation, the other one was further amputation,
yeah.
and both of them were able to totally restore their leg condition.
Yes. I
And
mean, diabetic wounds, venous insufficiency, ulcers. Yeah, it can be extremely effective.
yep. So continue on. So then you started looking at trying to see about treating the brain. What was the first initiative what got you to that point?
I had been teaching in Boston to a group of chiropractors, and about maybe a month later, 3 weeks later, I got a phone call from one of the chiropractors, and he had had a patient who he had effectively treated for arthritis. And she was then wondering, because she had had a traumatic injury, brain injury, and long term, which had affected her life significantly. She wanted to be treated on the brain. And that really was not something that was being done 20 years ago.
Hmm.
So he called to find out, could we do that? And if we did, how would we treat them? And so I said, well, I think maybe I should, talk to a few other clinicians, and did, and researchers. And most of them said, probably not going to do anything. The light may not even get into the brain, but it's not going to hurt. So we went ahead and treated her, and both Dr. Nazer and I were involved with that. In fact, it's her publication as the primary author of the first two case studies looking at traumatic brain injury. And she was our first, and she had remarkable results. Remarkable. I can't hear you, Tom. You seem
Oh,
to be, oh, there
sorry.
you
We
are.
just
Yeah.
had a muted there for a
Yeah,
moment.
no, no, it's great.
No.
So, and that's really how we started down that road of looking at treating individuals with neurologic or neurodegenerative conditions, and sort of moved on doing research, as I mentioned before, Alzheimer's and dementia, and stroke, aphasia, post-stroke, and then looking at Parkinson's. And throughout that, because my practice is virtual and really word of mouth, I started becoming involved with the autism community and some of those with Down syndrome, and
Right.
started treating those individuals, youngsters mostly,
Hmm.
kids, and then continued with adult. So
Wow.
yeah, it's been a long journey, but one that's been incredibly meaningful and
Well,
thankfully
when you can
powerful.
see, even if it's small improvements, if you can see people with small improvements and, like the one person when they said, that was so beautiful when she said, it's the first time he smiled at me in years. That just
Yeah.
was, it got my heart right off the bat. There was like, no.
Absolutely. I mean, there are standardized tools that we use in practice,
Hmm.
but hearing from a mother who had an autistic child who she couldn't touch because he would bite and scratch
Ooh.
and hit her, and she said it's the first hug in 7 years I've ever had from him. And so it's sort of like, yeah, this is what it makes
did you
it
have to
all
pull some
worthwhile.
tears from your eyes?
Yeah.
I
So, I
can
mean,
only
it's
imagine.
those sorts of things that can touch life that make all the difference in the
Yeah,
world.
it's so beautiful. When I heard in California the 4-year-old that started speaking
Right.
to his mom after,
Mhm.
4 years old nonverbal. And within the week of treatment, he was saying words, and he hadn't right up to that point in time. So
Right.
we just got another one just recently with 8 years old that was totally nonverbal. We'll have a case report on that. But within 9 days, he was talking to his mother. It was sentences.
Yeah.
So it's you definitely PBM light can reach inside the brain, and it's
Mhm.
beautiful to see what it
Yeah,
can do.
it really is across many different conditions. So let me tell you a little bit about our study. May I share my screen?
Yeah, absolutely. Please do.
Okay. Okay, great. Thank
It's
you.
coming. It just takes a
Yeah.
moment. There we go.
Okay,
We're
terrific.
good.
Dr. Nazar's on right now. So she was involved in this study as well.
Okay.
So when they talk about it taking a community to raise a child, well, it takes a community to do research, no doubt about it. So we're looking at the effectiveness of photobiomodulation light therapy in the treatment of both motor, and most people are familiar with the motor signs and symptoms of Parkinson's, but also the non-motor symptoms. This was a randomized controlled clinical trial with extended treatment, which was important. Um, and so we essentially, Dr. Nazar was involved, and myself and Orla Ayers, who I'll tell you about down in a few minutes, where the clinic was that we did the research, and Doctors Brian Bicknell and Anne Liebert out of Australia, who have done a lot of work in Parkinson's, a huge amount actually. And they were very important to the study, as Dr. Nazar was, our neurologist consulting. Jeff Herkes, Dr. Jeff Herkes was also involved in the study, and a number of other people who were involved in statistical analysis and other things. Just goes to show this is a joint effort.
Right. And we do have Dr. Nasser on now. I don't know. Some people may see her video. Hello. Nice to have you on tonight.
Oh, thank you. Thanks for inviting me. I look forward to it. Thank you.
Okay, so we're going to look at Parkinson's, which happens to be the second most common and fastest growing neurodegenerative disease. And Parkinson's highly individualized. So that means that 10 people in a room with that diagnosis are going to have a different set of signs and symptoms related to their Parkinson's. And if we look at the motor symptoms, resting tremor, which is something that's very frequently seen, bradykinesia, so that slowness and movement, rigidity, issues with balance and gait, movement of walking problems, freezing, facial masking. Many individuals who have Parkinson's aren't able to really smile or don't smile, and they don't show their expression. So it's very difficult to read them and for them to participate in conversation. And
Yeah,
then
and Anita, just the one person who has improved dramatically, just for those that aren't aware, I didn't know what freezing meant, really. But what
okay,
you just see somebody, he says, I could picture myself wanting to sit down, but halfway there and nothing else worked. Like I couldn't go up, I couldn't go down. I was just frozen in
yeah,
space.
right,
And he said that also happened with when he talked to somebody. He'd go so far, and all of a sudden, there's no more words that were coming out. He says, I
yeah,
knew what I wanted to say. Nothing would work for him.
yes.
Yeah, and the facial masking, yeah, that's something else.
Yeah, it's definitely an issue. And that freezing they often see, they would talk about getting into an elevator and then it was time to get out of the elevator or into the elevator, and just they knew what they had to do. They took those first few steps and stuck halfway in between the doorway and
Oh,
literally
no.
froze. And so it's those sorts of things that are really tough on a day-to-day basis. And then micrographia, we don't have that kind of loopy kind of writing. Instead, it's very, very tiny and tight and difficult to read. And then the non-motor symptoms are often symptoms that we don't think about associated with Parkinson's. So there are sleep issues, just the quality and quantity of sleep, but often many of them have very vivid dreams, which they act out, which can be terrifying for them and terrifying for their spouse because they're hitting and moving throughout their sleep. Impaired cognition, so changes in memory and in many different areas. Anxiety is a big issue for these individuals, as well as depression. Constipation, which interestingly enough can start 10 years ahead of the game before you're even diagnosed with Parkinson's. And it's important that we deal with that constipation. It's not a minor issue. Those toxins shouldn't be staying in the body for days on end. And fatigue is also another very common symptom that they talk about, which can be life-altering. So when we talk about current Parkinson's disease treatments, well, certainly the gold standard is medication. So whether it's the, levodopa, dopamine agonists, and medications to reduce symptoms, none of them halt or slow the progression. They sort of deal with the symptoms, but they don't stop that progression or slow it down. It can improve rigidity, slowness, but not often balance. And over time, they have these off periods, meaning the medication's taken, they have relief of their symptoms for a while, but that off period, so you take it every 4 hours or every 6 hours. And for that time frame, initially, that's very successful. Shortly maybe years after that, you have these off periods where no longer is that medication working for the extended period, but you've got this time where all these symptoms start to come back until your next dose. So although medication's important, it's not the answer completely. Targeted intensive exercise, very important. And there's a lot of research, and we'll talk a little bit about that down the road. So that is something that's being advocated. Deep brain stimulation, again, that's an implant where dopamine would be delivered into the center of the brain, specifically for Parkinson's and treating those symptoms. But again, that's an invasive procedure. And a duodopa implant pump, again, similar to a diabetic pump where it's giving that dose more consistently so you don't have those off periods. And then focused transcranial ultrasound. Again, a lot of research going on. I don't think that's a standard right now, but it is a possibility of treatment. So what we're finding is that Parkinson's is a complex condition with very individual symptoms. And there are very few treatment options that improve the set of symptoms and quality of life. So that we find in many conditions that a combination of treatments will give you the greatest likelihood of improvement in both the motor and non-motor symptoms. And when we talk about that multimodal approach, we're talking about the use of medications, ensuring that individuals are doing targeted intensive exercise. And what does targeted mean? That there are programs like PD Warrior, PWR Moves, Rock Steady Boxing. These are specific exercise programs that have been designed for individuals to address the sorts of symptoms they experience with Parkinson's. So it does help to improve symptoms and quality of life so that you're actually targeting muscles that you can use for functional activities like getting in and out of a car or out of bed, rolling in bed. So it's not just any intensive exercise. Some people will go, well, I'm just walking, and that's great, but muscle strength and other targeted exercise are important. Diet, we're seeing more and more being essential in these individuals as well. And then photobiomodulation, light therapy, and we'll talk about that. So in a way, why did we start thinking about photobiomodulation for treating Parkinson's? Well, we know with Parkinson's, there's mitochondrial dysfunction. What does that mean? It means the mitochondria are the engine of the cell. And so there's an impairment of energy metabolism, or the production of energy, as well as inflammation. And so photobiomodulation increases or provides energy for the cell to function more optimally and will decrease inflammation systemically throughout the whole body, but as well in the brain. Gut dysbiosis, which may contribute to leaky gut, affects, and think about it, those toxins leaking into the system, and that affects the gut-brain axis. And so what we're talking about there is, and when I talked about constipation a moment ago, that there are gut issues that can be affected many years even before Parkinson's diagnosed, and it has an effect on the brain. And if we look at the vagus nerve, the longest nerve in the body, and we talk about that gut response to something, and in fact, that can be very indicative of what's happening here. So in fact, we believe that Parkinson's can either start in the gut and move up to the brain, or may start in the brain and move down to the gut. And it contributes to neurodegenerative conditions, probably has an effect on Alzheimer's and other dementias, as well as other neurologic conditions. With the use of light therapy, when that energy is absorbed into the cell, we also get a release of nitric oxide that's stored in a cell that's not functioning optimally. And that nitric oxide also leads to vasodilation, just means an enlargement or expansion of the vessels. And we're not just talking blood vessels, we're talking about lymph vessels. So the lymphatic system takes away the toxins throughout the body, and the glymphatic system, which is specifically in the brain to take away byproducts of inflammation and other toxins within the brain. And so light therapy helps to dilate those vessels to get rid of and have better flow. Activating signaling factors. So you've got transcription factors, your glial derived neurotropic factors, and your brain derived neurotrophic factors are important, and they're particularly important for memory and cognition, and also just overall health in the brain. So PBM can support overall the cell survival, repair, and reduces inflammation. So that's why we're looking at using that for Parkinson's. So our study, although it's the largest randomized controlled trial for PBM for Parkinson's, is really based on a number of different studies that came before us. And a lot of that work's been done out of Australia. John Mitrofanis and many others, starting with some of the animal model work. And then later on down the road, they were looking at primates and the use of PBM and how it improved symptoms and protected brain cells in Parkinson's animals, or animals that had Parkinson's. Then some of the clinical trials, this is where Drs. Brian Bicknell and Ann Liebert come in. They've done some clinical trials looking at the positive outcomes of treating either just transcranially, the head, or just treating the gut, and reporting positive symptom control in both motor and non-motor areas. And then those benefits can be maintained for years with ongoing treatment. And they've just published their 7-year data, where a small cohort started with 12 and looking at, I think at 7 years, 7 or 5 individuals who maintained So when you talk about a neurodegenerative disease and the expectation is that people will decline over time, these individuals almost across the board maintained their benefit and positive outcomes throughout that 7-year period. So that's, I think, really reassuring
Yeah,
as
that's
well.
really fantastic news.
Yeah, it really is. So it's great to see. So a little bit about the study. We went through all the regulatory approval. So we had, ethics approval, Health Canada. We were registered with clinicaltrials.gov and had to adhere to all the consort guidelines. So we did what we needed to do this properly. We actually conducted the research at the Parkinson's Wellness Innovation Center in Hamilton, and it services Hamilton and the surrounding area. And Orla Hares is the director and essentially founder of that center. She's amazing. The center is incredible. They do exercise, they have support. They have access to a number of different photobiomodulation devices. So it's a fantastic center. So what types of or what sorts of symptoms did individuals who came into the study have? So they had mild to moderate Parkinson's, and that was diagnosed by a neurologist. They were stage 2 to 3, which is that mild to moderate. Idiopathic, meaning it was Parkinson's and not other variations of Parkinson's. And with some of them, the majority, but there were some that were not on Parkinson's medications, and they went through the screening for their inclusion, exclusion, and there's a very long list of those. So they were worked up well. So there were 3 stages. In the first stage was a randomized control trial. That just means that the individual doing the assessments, and there were 63 individuals who were enrolled. Orla did the double-blind randomized placebo-controlled trial. So half of our patients had active treatment, the other half had sham devices, but neither group knew what they were receiving. And so there were 31 in the active group, and in the sham group, 32. Now, in stage 2, there was a partial crossover, meaning everyone at that point, now there are 59 in the study, all of them received active treatment.
So-
We'll talk about what that treatment was in just a moment, but everyone received treatment. And then in stage 3, this was extended treatment. So at the end of stage 2, individuals made the decision of whether or not they elected to either continue treatment. They were our continuers, and there were 17 of them. And there were those who did not continue, the non-continuers, and there were 26 in that group. And we'll talk a bit about that as well. So these individuals continued their home treatment and then came in for an assessment so we could see how they were doing. This is pretty complex, but it just shows you when they were enrolled, everyone had a baseline assessment. We'll talk about what that entailed. And then there's the active group and the sham group. They did 8 weeks. So they went through 3 days of training in the clinic before they were given the devices to take home. And they were slowly not only taught, but the dose was not the full dose right away. So they did abdominal and neck. The next treatment was transcranial, the head, and then a full dose. And they had to demonstrate they could do the treatment effectively. And then they were given the devices and they took them home. They did 8 weeks of treatment, and then they brought their devices back. They had 4 weeks of no treatment. And during that time frame, they were assessed at 1 week post-treatment, so at the end of the 8 weeks, and then another assessment because they have 4 weeks of no treatment at the end of 4 weeks. So we were really trying to determine, was there a change with no treatment? In stage 2, everyone gets a treatment, the same thing, 8 weeks at-home treatment, 3 times a week treatment, the same as stage 1. Then they go through 4 weeks of no treatment, and then the assessment at 1 week and 4 weeks post. And then we move on to those that are the continuers or non-continuers. And protocols may have changed slightly when they started treating at home. They may have gone from 3 times a week up to 5 times. It was more or less their decision about how they would continue treatment. But again, and we'll talk about this treatment and what it entailed. So those are the 3 stages. This was extended treatment. So this was anywhere from 6 weeks to almost a year after they finished stage 2. So why such a big difference? Because when those who started right at the beginning ended and they started to restart their treatment, they were starting much sooner than the last person who entered stage 1. So that's why the variation there. So what was the treatment? It was a 2-part treatment. So it was transcranial treatment. And that treatment involved 20 LEDs. It was a combination of both 635 visible red and 810 near infrared. So a similar combination to what Tom's shown you in his. These were 24-minute treatments that they were doing at home. The first 12 minutes were red, next 12 minutes were infrared, and they provided that 3 times a week. They did that 3 times a week. As well, they were doing an abdominal neck protocol with a laser, and it was a super pulse laser, and 904. And they did that for 20 minutes, and it was 18 minutes on the gut. So it's hard to see down here. There are 9 points over, the large and small intestines, and they were taught how to do that, 2 minutes per point. And then there were 2 minutes at the back of the neck, and that gives you the total of a 20-minute treatment. And so it was a 2-part treatment, and they were doing these simultaneously. Put the helmet on, and then you were doing the abdominal neck treatment.
Yeah,
So
and I'll just mention one thing, Anita, is that if you want to flip back a slide,
Sure.
just because people in this webinar are trying to learn as much as they can, we're talking about near infrared light here, because
Yes.
sometimes some are thinking, well, I got an infrared sauna, won't that do?
Yeah.
Not going to help. This is near infrared light that can penetrate. So just a small little clarifications, but thank you.
Okay, great. So how did we know whether individuals actually improved? And so we had standardized, meaning these tests are done similarly across the board by whomever does the assessments. And since Orla was doing all of these assessments, she's a very experienced physical therapist, neurophysical therapist, and she's got a lot of experience with Parkinson's. So over a 2-year period, they were assessed 6 times. She was blinded. She did not know in stage 1 whether they were in the control group or sham group. So in fact, they got no treatment, but they went through that process. The devices emitted no light or active. And again, she didn't know in stage 2 because neither did the patients know whether they were getting in the previous stage 1 were active or sham. Everyone got treatment in the second. And then in the third, she was aware because there were those who continued and didn't. We did an extensive battery of tests. The primary outcome measure was the tug, and that's a timed up and go. And that's a measurement of time from you're in a seated position in a chair, you get up, walk 10 meters, turn around, come back, and sit back down. And this is a standardized test used in many different areas, and that was the primary outcome measure. There were also assessment of gait, dynamic balance, the MDS-UPDRS. So this is the Movement Disorder Society Unified Parkinson's Disease Rating Scale, mouthful. It's a standardized test that most neurologists use. The 360 turn, a smell test, because many individuals with Parkinson's lose their sense of smell, fine motor movement. So that was the writing, a spiral test, and having to put pegs into a board and having it timed. Cognition, so the Montreal cognitive assessment tool, which is scored out of 30. Mental health, looking at anxiety and depression, the Beck scales for that, self-administered, looking at quality of sleep, because that's a very important area. And then the Parkinson's questionnaire, 39 questions around quality of life. So it was a battery of tests. And we did those tests because the range of symptoms for Parkinson's is very broad, and we wanted to capture where we would see improvement. We did statistical analysis, and we were doing comparisons between the active and sham group, and then in stage 3, looking at continuers versus non-continuers. I'm going to go through this quickly. Essentially, you're going to see a similar sort of diagram here. They all had a baseline assessment. This is where they started. This is your stage 2, and the red is active, and that's your sham. This is still in I'm sorry, that was stage 1. In stage 2, you still have your active and your sham group, although all of them received treatment. And there was no clinically, statistically significant difference in the first 2 stages. With extended treatment, we see statistically significant positive change in the continuers versus those who did not continue treatment. So that's what that means. This little star means it's statistically significant. So it's not by accident that these individual outcomes are. And if we look at a p-value, it was 0.016. And that was our primary outcome measure. So we were very pleased about that. Now let's look at some of the secondary measures. And this is the MDS-UPDRS. This is the second part. It's a 4-part study or test. And a decrease is better than an increase. That's when you see improvement. P-value 0.048. So that was significant. But again, you see the baseline, your active and sham, no statistically significant difference, but there is with extended treatment. And you can see that statistically significant change in the continuers versus the non-continuers. And that's where that little asterisk comes. Now, when we look at anxiety, which is again really important, this is based on the Beck Anxiety Inventory, we see a significant difference, a p-value of 0.050. And again, your baseline, your active sham, no significant change there. But with extended treatment, we are seeing that change and a decrease in anxiety in those continuers versus non-continuers. And again, this is where we're getting close to significance. Again, no change in stage 1 or 2, and it's close to significant. Significance is 0.05. This is 0.058. So it's close to that. And that's the timed up and go. And this is when they're doing a cognitive test. So they're doing that time up and go test, but they're also counting backwards simultaneously. And then the total score with the MDS-UPDRS, and this is that neurologic score that's often done by neurologists. And again, we're seeing an approach to statistical significance in stage 3 with extended treatment with the continuers versus non-continuers. So we're seeing again improvement here, not statistically, but in a 9-hole peg test. So you've got pegs and 9 holes, and they have to pick it up either with their dominant hand or non-dominant hand, and they have to put them into the hole. So that takes quite a bit to pick up a tiny peg and put it into a hole. So it's a measurement of your fine motor movement. And again, we were seeing changes here, not statistical, but close to statistical changes. So, across the board, our primary outcome measure was statistically significant, seeing a significant change, positive change in anxiety and in the second part of the MDS-UPDRS, which is related to motor. And then again, approaching significance with the TUG again, but the cognitive, the total score, all 4 parts, and the dominant hand. So we were pleased to see that. So what does this mean? It means that for many individuals who have Parkinson's, they're not going to see change overnight. And this is important because we don't want people giving up on photobiomodulation until they really give it a chance. And so we saw significant positive improvements in continuers compared to non-continuers with extended treatment. And anxiety decreased, borderline improvement in quality of life in the questionnaire, non-motor symptoms, which are often overlooked and hard to manage, can't be managed with medication. We saw changes, positive changes, and additional qualitative findings like facial expression, handwriting, speech clarity will be reported in a future publication that we're working on right now. So we have to talk about some of the limitations, although this was a relatively small study, 63. It's the largest randomized clinical trial doing photobiomodulation for Parkinson's. But if you look at drug trials and others, relatively small. Impact of medication was not explored. It was only an 8-week intervention, probably needed to be longer. Potential placebo effect. We know that with Parkinson's, more than almost any other neurodegenerative or neurologic condition, Parkinson's does have a long placebo or a high placebo effect. But when we look at the extended treatment, if there were placebo effects, they wouldn't have continued that long. Placebo effects don't normally go into a year. There was no imaging. That would have been terrific, but it's a very costly addition to the study. Range of exercises were used within the study, and there were variables in the total number of light therapy treatments in stage 3. And that's because individuals started their study much sooner than others. But this really reflects real life conditions in clinical practice and clinical research. So if we, some people are interested, okay, so if we're looking at the continuers and range of treatment, it was between 12 weeks and 48 weeks. And you can see, there's some in the range of just 12 to 20 weeks. And then the next larger cohort between 37 and 48 weeks. So that's sort of looking at the continuers. And so in conclusion, it's the largest PBM trial looking at treating Parkinson's over a 2-year period. Significant improvement in not only the primary outcome, TUG, but other secondary outcomes and anxiety and motor testing in the UPDRS. It's safe. There were a few minor temporary reactions, and only 3 of them we believe were related to PBM. One was headache, an increase in vivid dreams, and patchy hair loss, which we really wonder about because we treat hair loss with light therapy. So that's probably questionable. And I know what you're going to say, Tom, so say it now.
Yeah, it was the barber or the hairdresser.
Yeah, right. Oh, that. Okay. But yeah, we've seen many individuals actually tell us that their hair growth has increased with using it transcranially. And in the long scheme of things, the PBM is low cost because it's a device that can be used ongoing, easy to use. And we were given every feedback from individuals that it was easily incorporated into daily life and suitable for home use. So we believe it can be extended and much larger use. And it highlights the need for a multidisciplinary multimodal or many different strategies for treating Parkinson's. And the ultimate goal is we want to create clinical practice guidelines that integrate light therapy, photobiomodulation, into clinical practice so everybody has access to it. So that's how to get a hold of Orla or myself. And if you want the manuscript, you can take a photograph of, or scan this, I should say, and you'll have access to the manuscript of the data I just showed you. And then if you want the references that were referenced throughout, if you scan this QR code, you can also get that.
Wow.
And so I know we have some questions, but before we move on, Dr. Nazer, if you could maybe unmute yourself, we are going to talk about some of the learnings, and I'd like you to pipe in at any point in time. I know you're going to talk about some of your experience with stroke and aphasia and your CTE population that you treated, but I think if we're looking at, is there a need? And this is a question we hear often. Is there a need to treat ongoing? And our experience so far is in neurodegenerative conditions. So those are conditions that will continue to worsen over time, like Alzheimer's and dementia, Parkinson's, ALS. Our experience has been, yes, there's a need for ongoing treatment. And in fact, if you stop, you can regress back to where you were previously. And yes, you can restart and often regain what you've lost, but not always. So the recommendation is for neurodegenerative conditions that you probably need to continue treating. Any comment about that, Dr. Nazer?
Oh, yes, I do see big differences. If it's stroke, they can get the improvement and they can pretty much hold on to that improvement. If it's an isolated active range of motion
Right.
for the elbow and whatnot, or even the hand. But in some cases, depending on how severe it was to begin with, they will need to continue treatment, even though it's not progressing neurodegenerative. But traumatic brain injury, simple traumatic brain injury is nothing simple about it, but a car accident, for example, they do very well after their first series of treatments, 3 times a week for 8 weeks, 6 or 8 weeks, and they improve. They keep improving after you stop treating. That's really good. You got the brain sort of back together there for those car accident victims. But when you get into football players, and we did treat 4 with possible chronic traumatic encephalopathy, and they were just, before they even came in to see us, they were just getting worse and worse and worse in terms of PTSD, and their cognition was just getting worse. And then we treated them, Monday, Wednesday, Friday, 6 weeks, and they did great 1 week after that initial testing and a month later. But by 2 months, plummeting, going downhill fast. And you saw that in your own study with the dementia cases also, Alzheimer's disease cases. That's a progressive degenerative disease. And so when you've got that aspect in it, it becomes another whole new ballgame. That's why your continuers are doing better here, I'm sure, in our study with Parkinson's. You've got to keep treating. And if you wait too long after your formal treatments in the research program and you hem and haw and I don't know if I want to spend the money, I don't know if I want to do it, you can wait too long and you just can't get them back. So they have to be on top of it. They have to understand they have a progressive neurodegenerative disease.
Right. Yeah. And then, long-term ongoing treatment may not be required in some neurologic conditions. So as Dr. Nazer was talking about stroke and aphasia, or in some instances with concussion and traumatic brain injury, although I've certainly had patients who, they've done a series of treatments and need to continue it, because if they don't, any stressor, flu, really busy time at work can just set them back, and they end up with symptoms. So some ongoing treatment may be necessary. We know after 25 years, I mean, you've been treating longer than I think even I have, that it's safe and it can be an effective adjunct. So what's great about it is that the research, and I was involved in the muscle, joint, and body treatment beforehand, that if you compare just light therapy on its own, or just physical therapy or chiropractic on its own, or you combine them, the addition of light therapy to either the chiropractic or PT can enhance outcomes by about 30%. So there's a real adjunctive supportive quality to the use of light therapy. Can it be used on its own? Yes, but in more complicated cases, it'll be multiple different treatment strategies.
Yep,
And if there is
conjunctive,
a
it's
reaction,
beautiful. It's beautiful having multiple treatments working together.
absolutely, whether it's diet or exercise or stress relief, this is very helpful for sleep. And so all those things are really important. If there is a reaction, if you stop treatment, often in a day or two, those side effects or reaction to treatment resolve. And there's really exciting evidence coming out now showing that photobiomodulation may be preventative, as demonstrated in a study by Dr. Lou Lim and crew out of University of Utah, right, Marnie? Where they
University of
treated
Utah and Brigham Young University,
and
both
Brigham
big
Young.
time
Thank you.
football powerhouses.
Yeah,
Yeah, they're just
yeah.
gigantic. Yeah, big names.
And so they treated football players all through the season, and what they were able to see, and in talking to Ann Liebert today as well, because she has treated football players, rugby, or not rugby, but soccer football players as well. And they've been able to demonstrate that for players that are treated all the way through the season, there are fewer injuries and they're in the game a lot more games, or in the sport a lot more games over a season without injury. And there was a prevention of concussion. We've seen other body injuries as well. So it's really nice. This is the first time we've seen a study in print looking at the preventative aspect of PBM. And that may well, I mean, I've treated families, entire families, where mom and dad and grandma and grandpa all had Alzheimer's, and they didn't want it. So they started transcranial and intranasal treatment to try and prevent things. We didn't have the research to show, and this is really around concussion, so it's making a leap, but it's suggestive that, and we know from some of the research being done in what we call normals, that they can improve college students in their, cognition and planning, speed of, processing, all these things. So I think that's really positive as well.
Anita, the other thing that's you're mentioning here is the ability to think faster on
Yes.
things. And so we just recently did an interview on a gamer who plays a lot of games for the last 20 years, internet games. And one of the things is speed and processing time and also to be fully aware of all the settings. So you got to try and have your brain full width to all the things that could be coming in from the outside area that could be something that will wipe you out in the game. And he said his ability to think faster and to also be able to spatially see things, even preventing, him getting taken out just by the fact his brain was able to see so much more of the playing field. And I wonder
That's
in a
an
way,
interesting demonstration of that.
and I wonder if there isn't something to this prevention of concussions. Maybe a few of the preventions were just the fact that they saw somebody coming in was going to wipe them out.
Oh, that's an interesting.
That's right. That's very interesting, right?
Might be.
Yeah, I want to mention brain imaging that was part of that study on the prevention. This was really, really a good study. It was out of the University of Utah. And the first author is actually a woman named Lindsay. Last name is Lindsay. So it's Lindsay et al. 2026. But they did brain imaging, and University of Utah has a really very advanced, MRI program, and all the football players got the MRI scans before preseason. This included preseason and the full regular football season. And then again at the end, they got a second MRI scan. And the MRI scans, it was very complicated, but you can, kind of pull it out that those who got sham, half of the football players got sham. No LED light, near infrared light was coming out of the V light neuro gamma they were wearing on the default mode network and in the nose. No light coming out. And it's really scary to see those images postseason without any protection from photobiomodulation. They had increased brain inflammation. Inflammation is the origin of so many progressive neurodegenerative diseases and all sorts of problems. But for those players who got the real near-infrared LEDs, again, just on this default mode network and in the nose, no inflammation. In fact, the white matter in their brain was improved. So
even with all the hits,
all these knocks on their head, but they're doing photobiomodulation Monday, Wednesday, Friday in the athletic training room under supervision, and it's the 20-minute treatment. And that's not a lot of time, but it's enough. These are young kids. I mean, what are they, 21 years old or 18? And I think it's easy to treat young brains. I think it's really hard to treat older ones, but the younger ones respond very well. So that is wonderful because they got that backed up with excellent MRI scans.
Yeah, no,
One thing
really...
I wished, there's such a large audience on tonight. I wish that maybe there is somebody who's a principal of a high school or a college that want to take this on. But wouldn't it be great to have half the students get treated and half not be treated, and see how their cognition works on their exams?
Yeah.
Wouldn't that be?
I feel sorry for those who are in the sham group, though.
Yeah, right.
Okay, maybe do it second. Maybe do it second year students
then
so that they got a chance to catch up, right?
Yeah, they're going to
need it. So, are there questions, Tom, that individuals have?
Yeah. So on the side here, I can read some of them. They're in a fine print. Some people saying thank you so much, but I'll go through these very quickly because we are later in the thing, and I'm so glad both of you were able to come on. But I'll just I'll answer one quick one here. Peg is asking, "How would the light work on toenail fungus?" Thanks.
Oh, right.
And I got there's a benefit to that.
There is benefit to that. Not these lasers necessarily or LEDs, but they're definitely foot fungus, toe fungus can be treated.
Yeah, and that ties in with methylene blue is used as a catalyst.
And is it blue light, Anita? Is it the blue light that they use to treat the toe fungus?
Usually, but they can also use a high dose of red.
Yeah, 660 nanometer red with and I know of a big group that's using paint on methylene blue, so just something to know.
Okay.
Yeah, Michael is asking, thank you all of you for asking questions here. Hi, Anita. What successes have you had in treating plexopathy in cubital tunnel blockage that went into the dorsal? Wow. Interosseous abductor.
Can you just ask that she
I think
send you an email? And
Michael, it's Michael. So Michael, please send us an email and I'll forward that on.
That would be perfect.
You ask a second question, which is far easier for me to read than the first one. Have you had luck with late stage Parkinson's? My friend has that, very spastic and non-mobile on a walker. Speech is limited.
I mean, this study did not include severe, sort of stage 3.5 or 4, but I still think it would be worth trying. I definitely think it would be worth trying, and I would want to see a combination of gut and transcranial, and maybe even intranasal. So,
Yep.
yeah.
Sounds really good. Susan is asking, did the TPBM study participants have pulsing in the administration of the light, or was it simply the
Yes,
exposure?
actually, that's a great question. It was pulsed at 40 hertz.
Okay. All right.
Yeah.
Thank you. Thank you.
Which
And
is the pulse rate that they used, well, with it's a pulse rate that has been used to remove beta amyloid from the brain in mice that had Alzheimer's disease.
yeah,
So it helps to remove a toxin. And one other thing I'd say about all these studies is people are starting to suggest to do the transcranial treatments at night, just before bed type of thing, because that's when the body is basically programmed to bring in a lot more cerebral blood flow into the brain to massage the interstitial space and the cells that were making all these waste products all day long. And you have to have good sleep to remove those waste products every night. And if you can't sleep, you're in trouble. And every single football player who came to me in our office at the Boston VA, they complained they could not sleep. And Anita will tell you that's true for the dementia
yeah.
cases too.
And
And
many of
guess
the
what? We've
Parkinson's
seen
too.
over and over again that people that have used, in our case with our helmet, and I'm sure, and I know it's with other light therapy devices out there that are, substantial medical grade stuff, is that they've seen much better sleep patterns for those individuals that have used the light.
Yeah.
Mhm.
Uh,
And
and
it's
we,
hard because I totally agree the sleep, but there's also some research to indicate that light therapy, and maybe that's where the visible red intranasal is used in the morning to help regulate circadian rhythm. But yeah, it's hard to know, but that, getting rid of neuro waste products and neuroinflammation is really, really important.
Now, I don't think that this is in particular to do with the brain. That just talking about lymph drainage therapy is so good in conjunction with PBM. I think that's general
Yeah,
lymph.
I think that's a really good point.
Yeah, thank you, Susan, for your question. Um, okay, so Yvonne is saying that is good to know about the preventative treatment. I'm hoping that includes cognitive, and I think that as well. You're just
Oh, they
improving
did do
cognitive.
cognitive testing. Yeah, they
Yeah,
will with the football players. Yeah.
yep, yep, and
Mhm.
and yep, and thanking people are thanking people. So both of you for coming on this thing. That's very
Mhm.
much appreciated for sure.
Yeah.
Lisa's okay. Okay. All I'm seeing. Okay, where was the QR code supposed to take me to the transcripts from the webinar? No, not from this webinar. Or did you have it as well? The QR.
No, the QR code, which I can go back to this, can you see that, Tom, or
Yes.
no?
Yeah, it came
Yes,
up.
this is the QR code for the manuscript, so the actual research paper that was published.
Ah, okay, but it's not for this specific slideshow.
No, no,
No, okay.
but all the data from the slideshow
It
is
was
and more is in the manuscript.
okay. Okay, Baudouin is thank you for this fascinating presentation. Have you seen trembling being reduced as a result of the treatments?
Yeah,
Tremor.
tremor was decreased. Um, and it wasn't one of the sign or symptoms that we saw a significant change in, but that's not to say that it isn't for some.
Mm-hmm. Okay. Romel is asking, thank you, Romel, for your question here. Can you please comment if there's any study related to PBM for acoustic neuroma? I'm not familiar with that. I have a client in her early 70s with this diagnosis who presents with balance problems, difficulty hearing, facial numbness, and difficulty sleeping. Is that a kind of a spin-off of Parkinson's, or is it something totally different?
No, it's totally different. Marnie, what do you think?
Well, I don't know that I've ever worked with photobiomodulation to reduce a tumor. A neuroma is a tumor.
Yeah.
And so I certainly, it's not my field at all to talk about that.
Okay.
Um,
Um, I I don't know about long term, but we've been able to see some people with specific tumors holding well, and not
Holding, yeah,
growing.
maybe, yeah.
And one in particular
Holding.
had a shrinkage, but that's another thing we hope and
Mhm.
that someday more studies could actually be shown to see
Mhm.
this. Susan is saying thank you so much. What an amazing program. So thank you.
Oh, thank you.
Um, Boy, this is going to be hard to pronounce. Sornakumer as saying interesting research and presentations on PBM and Parkinson's. Thanks. Queries. One, why was timed up and go the primary study evaluation parameter? And then I'll say the second question is using PBM in the digestive area, does this increase
Mhm.
dopamine? So
Yes.
let's
Okay.
go
Let's go
to
with the first one then. And the timed up and go, we had an effect size. So the previous research that had been done in Australia, we knew with the timed up and go, not the MDSU PDRS, which is the neuro tool, we knew approximately how much change they had seen. And when you try to determine how many patients or how many participants you need in a study, you need to know the approximate change size. So what do you expect to see in change? We didn't have that with the MDSU PDRS. If I did another study, that would be the primary outcome measure. So that's why the timed up and go was used.
okay. And the dopamine question?
Dopamine, yes, we know from treating the gut that we can decrease the inflammation in the area, but very large percentage, almost 80% of the dopamine is actually produced in the gut, and an increase in serotonin, which can help with mood as well as some effects of depression. So,
Okay.
yeah.
What about good questions here? What about and maybe in effect, if it helps constipation, how about restless legs? Is that
It does help with constipation. It can be very helpful, the gut protocol. Restless leg syndrome can be helped with PBM. That's not the protocol we would use, but there is a protocol available for that, and it
okay?
seems to be quite helpful.
You know,
There
when
was
it
a foot, yeah, there
go.
was a football player who went through the University of Utah um, sort of CTE program, possible CTE, and you can see it. It's I can give it to you. There's a link. It was released just before Thanksgiving, well, November 2025, and it's a 6-minute video. It's really wonderful. And one of the main complaints of that football player, before he's in his 40s, before he got photobiomodulation, was he had so much restless leg syndrome at night, and it was so severe, he kicked holes in the sheets in his bed. Now that's serious, just,
Yeah.
restless leg syndrome. But he used that V-Light neurogamma. He did what they told him to do in that study from University of Utah, treated at home. He's out in Oregon. Rico Petrini is his name. And I can give Tom the link. You can get to it. It's a very, very interesting. People have no idea how
How
severe
distressing.
the behavior can become deranged in these football players. And a lot of them commit suicide. I mean, you have to understand how serious this possible CTE is. Yeah.
Mhm.
Thank you for asking about restless leg syndrome. I mean,
Yeah, no, and even vivid dreams is a big thing. And it's a significant symptom in Parkinson's, and we've seen changes in that. Now, you have to be careful because you can give too much energy and actually increase
Mhm.
vivid dreams. So
mhm,
again, our whole motto of starting low and starting slow low dose and slowly, gradually increasing that is important for many of these individuals.
Yeah, one other thing that the question came up here about our helmet. We are looking at our helmet was done in a study with opiate addiction and depression in West Virginia, Shepherdstown,
Mm.
West Virginia. But we are looking to new studies coming on board for migraines in the Pittsburgh area. We're looking at
Fantastic.
Alzheimer's study going to start up soon, as soon as we get the IRB approval in Dallas, Texas. And we know that there's interest in Parkinson's as well. So, yes, some of these things are going to take place. But here's another quick question for both of you. Anita, first of all, did you happen to get the Cognivue device?
Not yet. You can't believe it will come. We
It'll
had
come.
to
Okay. All right.
jump all these
Anyways,
hoops.
there is a device that may help with future studies in that we're going to be using it for our studies in Alzheimer's. It's a device to measure the ability of somebody who's got early onset of dementia or well, different things, Parkinson's, Alzheimer's, and it's FDA registered as a cognitive measurement device. So you don't have to be, it doesn't change from person to person who's doing the test on the person. Now
Mhm.
you've got a computer in front of you and you've got a very simple wheel that you have to turn one way or the other. And believe me, even for the best of people, I've been on it. My employees have been on it. It does go from 0 to 100%. And what we were able to see, which was really fascinating, the company, one of the employees said to me that he's been at it for 7 years. He says the increase in performance that you could get, let's say, by doing two back to back, so you got better because you did it twice,
Hmm.
Right.
would
Learned.
be like 3 points. That would be it.
Hmm.
And so when I told him I'd like to put the helmet on me and I'm going to do the best I can, and I wasn't faking out, I wasn't trying to fail or anything. I just did the best I could in the first round,
Yeah.
and I put the helmet on me, and I did it a second round after the helmet treatment, and I scored 10 additional points. I went from
Oh.
I and he was just dumbfounded that there was such an improvement
Hmm.
because I put the helmet on. And we're seeing it now with a number of our employees. Now, sometimes an employee you can't get if they've got a good score to start off with, it's hard to get a little bit more.
Hmm.
But for some of the older folks like myself, you can see that jump after you use the light. But everybody should be using this light for cognitive abilities.
Oh,
I
yeah.
think,
Yeah.
long term, there's no downside, as you guys were saying, but if anything, good upside. I see the time that we have, and I know there's probably a few more questions, but I'd say one thing is there are so many people that are thanking us for this program. I can see one screen here that's probably 10 thank yous of all different people.
Oh,
So
that's sweet.
there's a lot of people that thank you for coming on tonight and sharing your heart of trying to help people. So thank you very much for that. And do you have any last comments that you'd like to make? Go ahead, Margaret.
Well, I'd like to say that sleep is really important. And I myself have noticed, I just got your super helmet. I want to work with it. And I have a family, a family member who has, autism, and I want to work with that with him. And the person who came, my trainer, on Saturday, we worked 3 hours and got the helmet together, thanks to Faith. She got us doing the right screws and everything. And I mean, so my trainer did it for 4 minutes, 1 minute red, 3 minutes near infrared before he left on Saturday. I did it Saturday before, at the same time. And then we're back and forth about, boy, did I sleep well last night? And we're sleeping so great. And that's what really turned me on to this back in London at the WALT meeting, World Association Laser
Yeah.
Therapy. That was 2024. So I just thought this would be fun to have. And yeah, I just tell people, just if you want to have a super duper sleep, just get this and treat at night if you can.
Oh, it was funny when I got and he said it was okay for me to say this, Dr. Maroon, who's a neurosurgeon. He
Mhm.
said
Right.
he did the helmet, and the next day he says, um, is that a placebo effect or what? Because I slept so good. I haven't had such a good sleep in a long time. And I says, no, 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 that's
No,
not
it's
a
No,
not.
not
placebo.
placebo. Yeah,
We've just
Mm-mm.
if that's if that's a regular placebo effect, everybody should buy it just because
that's
it's a
right.
placebo
Placebo
effect. You
effect.
know,
Yeah,
Yeah.
it's
right.
that good.
No, it's
Yeah, it's
And
PBM has, we're just scratching the surface of
mm,
what is going to be possible, I think. It's really quite amazing
oh,
technology
and
across the board.
that is fantastic to have both of you on. I wish God's richest blessings on both of you. And for all those that have tuned in tonight, think of all the people that are around you that you can help if this technology can move forward. So what I'll say is make sure you go to our to our YouTube channel as well and go to SunPower LED, search for at SunPower LED and do a like and subscribe. When you click that like button, what that does is it just gives us really wide exposure on that video. So please like, and if you subscribe, what happens is then every time we get a new video, you'll know that there's a new video that just came out. And we will have this video up as soon as we can. Usually, we try and get it in within the week. There's things we got to do. But we try and get it up in a week if we can. So, and then also come to our website, SunPower LED, and then go on that side, go to the products page, look up the helmet, and then just click purchase. That's all you need to do is just click the purchase. We love it. Okay.
sure.
So, anyways, well, thank you everyone for coming on tonight. We had a great group on and spread the word and tell others as well. And oh, by the way, scroll up to the top. I can tell you who the winner was. I saw it somewhere here. Joel he's from Ontario. Joel, congratulations. You have won the Palm Ultimate. So, congratulations. And
Oh,
when you
yeah.
start treating yourself and then start treating all your other friends, come back and buy a few more of our devices. Okay? So anyways, all the best everyone. Thank you.
Thank you.
Bye.
It was nice. Enjoyed it.
Night.